Please.
My name is Sandeep Puri.
Hi, Sandeep. Nice to meet you. Great, great.
Hey,
How are you?
I'm doing well.
What floor do you want, by the way?
The top floor, please. Yeah.
Excellent.
Dr. Checo, I hear you're big on health innovation. I wanted to share with you a innovative diabetes care management solution that we have developed at Patientriciti. Would you like to hear more about it?
I would love to. Please, tell me.
So our solution is a remote care management and care coordination solution that on one hand helps empowers patients with self-help tools to manage their condition, and on the other hand it helps doctors track the status of their type 2 diabetes patients in between clinical visits so that they can intervene if necessary. And the way they do that is by asking the patients an ongoing series of questions about their blood sugar levels, diet, exercise, medication, etc. And our solution takes that responses and using evidence-based protocols, it is able to alert the right members of the care team to intervene when necessary. And we are currently piloting our solution at a few clinics, and once we prove efficacy for diabetes, we plan to extend it to other chronic care situations. I'd love to share more details with you.
Yeah, please tell me. Like, what are some of the things that a patient can answer that would kind of prompt an alert?
Yeah, sure. So I'll give you an example of the pilot that we are currently doing. We have questions there about their blood sugar levels. Okay. So based on conversations with our client, we have set trigger levels, for example, for the lower limit and the higher limit.
Okay.
And if the response from the patient is above that number or below that number, it triggers an alert for the diabetes nurse. Same thing for medication. If you're asking that question on a daily basis, and the trigger we're using is if more than 5 out of the 7 days in the past they've said no to taking their medication, it triggers an alert for the care manager to intervene and ask what's happening.
So, I don't know, off the top of my head, if they're not compliant with the medication, how do you think you're going to circumvent them being compliant with the software?
Yes, as you're aware, I mean,
invested in it.
Diabetes management is a complex socioeconomic determinant condition. So one of the unique things about our solution is the ability to go into second and third level questions to determine the deterrence to a certain kind of behavior. So for example, if they're not taking medication, we can get into a cascade of questions about the reasons for non-compliance, whether it's the ability to afford medication or whether it's the ability to go to the pharmacy, and depending on the kind of response, the right member of the care team can intervene. Okay. So it's a social worker or a diabetes nurse.
Yeah. Well, diabetes seems to be one of the hot topics, right? Like everyone's kind of concerned. It's one of the big issues facing American healthcare. What do you think, and there's a lot of people trying to tackle the problem, what do you think that you're bringing that's unique to what the other solutions are offering?
Yeah, I think you're absolutely right. I mean, really when we talk about innovation in healthcare, the ideas are, not really that innovative. It's the execution of it, and the reason for that is that patient engagement is hard, and behavior change is even harder. So what we are trying to do with our solution that is unique is using 3 drivers that helps us improve engagement and behavior change. So we are using elements of marketing science, behavior science, and data science to firstly make sure we are reaching every segment of the population, meaning our solution addresses not just the tech-savvy English-speaking segment of the population, which some of the other solutions are trying to address, but we are able to do multilingual, multimodal conversation, so we're able to reach multiple segments of the population. That's on the marketing science. On behavioral science, we are able to actually determine the reasons that are in the way of behavior change, and we are able to determine what are the incentives that work for that particular patient or that particular patient segment that will encourage them to change behavior and sustain the behavior change. And thirdly, on the data science, our adaptive learning platform, it learns from the history of responses with the patient and improves over time so that we are more and more personalized in our engagement with them. So using those 3 elements, we are trying to be better at improving engagement, at encouraging behavior change and sustaining the behavior change.
Right. So one of the things that comes up for me is a question, and it looks like we've got about a minute left in this elevator. So when, diabetes patients span the range of like ages and, any kind of spectrum you can pick, right? And one of the problems I've seen in companies that are trying to be all-encompassing, one-size-fits-all to like every possible patient out there, or every possible user, is you get kind of a Swiss Army knife, like a one-size-fits-all, elastic waistband, stretchy, like bad pair of pants for anyone type thing, right? So is there I think that there's some real gain in like picking a population that you are particularly jazzed about, that then you can figure out, okay, what's a solution for diabetes management for teenage girls, right? Like, and kind of getting, is there a population that like really jumps out at you that you think that would be a great population to nail?
Yeah, that's a great question. So while we are trying to build something that can engage multiple segments of the population, I think what we are uniquely positioned to do is to address the Medicare, Medicaid population and the non-English speaking population. So most of the interest that we're getting in the early stages here are from provider organizations that are not being addressed by some of the common solutions out there that, like I said, are targeting the smartphone carrying English speaking
I think
people.
that was our door.
Oh,
I'm sorry, I gotta rush into surgery.
thanks for your time.
Thanks so much.
Love to share more details, and perhaps maybe you can introduce us to some provider organization that could benefit from our solution.
Excellent. All right.
From the audience, and Rajan, if you wanted to come up. Oh, yes.
Thank you. Great job. Who's going to pay for the service? Is it going to be the DaVitas of the world? Is it going to be the payers of the world? The physicians? Can you explain a little bit about that?
Yeah. So we are currently targeting providers, and within the providers, we are targeting. That was for me, right? The question.
Yeah.
Okay. We are targeting the, for example, the multi-specialty physician groups, IPAs. Our current pilot is actually with a academic hospital that has some clinics that are trying to serve the underserved population. So, what's that?
FQHCs or?
Yeah,
Okay.
yeah, exactly. So that's kind of our starting point. But I think there are some payers that are getting into, for example, Medicare Advantage plans. So we see opportunities there too. But our starting point is providers.
Thank you.
Okay, one more question.